Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Musculoskeletal medications. Adalimumab, Humira, is given to a client for the treatment of rheumatoid arthritis. Which of the following side effect is associated with the medication? Option A. Numbness. Option B. Diarrhea. Option C. Urinary retention. Option D. Weight gain. Right answer is Option A. Numbness. Adalimumab, Humira, has been associated with neurological side effects such as numbness, tingling, dizziness, visual disturbances, and weakness in the legs. Options B, C, and D are not associated with the use of medication. A client receiving Azathioprine, Imuran, complains of hair loss. The nurse tells the client that Option A. Hair loss is irreversible. Option B. Hair loss is uncommon. Option C. Hair loss is temporary. Option D. Hair loss is a sign of toxicity. Right answer is Option C. Hair loss is temporary. Temporary hair loss may occur. Normal hair growth will return after treatment has ended. The client is about to start the treatment for juvenile rheumatoid arthritis. Before the administration of etanercept, Enbrel, it is important for the nurse to Option A. Ask for an allergy to latex. Option B. Ask the client to postpone vacation trip abroad. Option C. Tell the client to not miss due vaccination while on treatment. Option D. To avoid people with a recent injection of etanercept. Right answer is Option A. Ask for an allergy to latex. Before using etanercept, tell the physician or the nurse for any allergy to latex or natural dry rubber that can be found in the pre-filled syringes or auto-injectors form of the medication. A nurse is giving medicinal instructions to a female client receiving Leflunomide, Arava. Which of the following is an appropriate instruction with the use of the medication? Option A. To use an effective form of birth control while on the treatment. Option B. Breastfeeding does not have to be stopped during the treatment. Option C. To use cholestyramine to lessen the side effects. Option D. It may take 3 to 5 days to notice any improvement while taking Leflunomide. Right answer is Option A. To use an effective form of birth control while on the treatment. Use an effective form of birth control to avoid pregnancy while taking Leflunomide because of its teratogenic effect. Option B. The medicine can be excreted in the human milk. Option C. Cholestyramine decreases Leflunomide's effectiveness. Option D. It may take 4 weeks or more to notice any improvement while taking Leflunomide. A client with rheumatoid arthritis is receiving Hydroxychloroquine, Plaquenil, in the recent months. The nurse tells the client to visit which of the following while on the treatment? Option A. Dentist. Option B. Ophthalmologist. Option C. Pulmonologist. Option D. Endocrinologist. Right answer is Option B. Ophthalmologist. Plaquenil can adversely affect the eyes such as retinal damage. Clients taking this medicine should be seen by an ophthalmologist at least once a year. A client has just been prescribed with Methotrexate, Trexall, for the treatment of rheumatoid arthritis who did not respond to any other treatment. An important reminder for the client is to Option A. Clay-colored stool is a normal response of the treatment. Option B. Pregnancy is not contraindicated with the use of the medication. Option C. Strict hand washing. Option D. Get a daily source of sunlight during the day. Right answer is Option C. Strict hand washing. Clients taking Methotrexate are more likely to get infections or may worsen any current infections. Therefore, hand washing will help to prevent the spread of infection. Option A is a sign of a liver toxicity and the physician should be notified of it. Option B, pregnancy is not allowed during the treatment. Option D, photosensitivity may happen during the treatment, so the client is advised to wear sunscreen or any protective gear against the sunlight. A client who is taking Methotrexate, Trexall, asked the nurse on what is the appropriate activity while taking the medication. The nurse advised the client to play which activity? Option A, basketball. Option B, ice hockey. Option C, football. Option D, tennis. Right answer is option D, tennis. Avoid contact spots or other situations where bruising or injury could occur because the medication can lower the number of platelets, which are necessary for proper blood clotting. Options A, B, and C are all contact sports. The nurse is reviewing the client's history who is about to take Methotrexate. Which of the following drugs can be safely administered together with Methotrexate? Option A, tetracycline. Option B, folic acid. Option C, sulfamethoxazole. Option D, phenytoin. Right answer is option B, folic acid. Clients who take folic acid supplements lower the risk of GI problems and mouth sores brought about by the use of Methotrexate. Option A may decrease intestinal absorption of Methotrexate. Option C and D, Methotrexate is partially bound to serum albumin, and toxicity may be increased because of displacement by certain drugs, such as salicylates, phenylbutazone, phenytoin, and sulfonamides. Alendronate, Fosamax, is given to a client with osteoporosis. The nurse advises the client to Option A, take the medication in the morning with meals. Option B, take the medication 2 hours before bedtime. Option C, take the medication with a glass of water after rising in the morning. Option D, take the medication during lunch. Right answer is option C, take the medication with a glass of water after rising in the morning. Alendronate needs to be taken with a glass of water after rising in the morning in order to prevent gastrointestinal effects. A client with osteoporosis is asking the nurse regarding the use of salmon calcitonin, myocalcin, nasal spray. The nurse tells the client to do the following, except Option A, delivery system contains enough medication for at least 30 doses. Discard any unused solution after 30 doses. Option B, if you do not feel the spray while using it, repeat the dose on the other nostrils. Option C, myocalcin is usually given as one spray per day into only one of your nostrils. Option D, take extra vitamin D while you are using myocalcin. Right answer is option B, if you do not feel the spray while using it, repeat the dose on the other nostrils. Myocalcin spray delivers a fine mist into the nose. Even if the client does not feel the spray while using it, the medication is still being absorbed by the nasal passages. Option A, discard any unused solution after 30 doses because spray may not deliver correct dose. Option C, use the other nostril the next day and continue alternating back and forth for each daily dose. Option D, vitamin D helps in treating osteoporosis by helping in maintaining healthy bones. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.